Good morning, good morning, good morning. This is your lecture for first aid and trauma. This is the very last lecture for this semester. So, first of all, I want to congratulate you guys for making it this far and thank you for your patience and diligence in listening to these videos. So today we're going to be talking about first aid in this video. Principles of first aid really pertains to responding to an emergency in the community or in the home environment. And so just as a precursor for this video, just make sure that you're thinking in that mindset, responding as a first responder, and also the goals in first aid. All right, so let's jump into it. So I started by talking about the goals in first aid. Priority in providing first aid is you want to provide immediate care that can save someone's life in the event of an emergency. Given that criteria, you want to make sure that when providing first aid, number one, that you as the responder remain calm, because the last thing you want is to become overexcited and then also cause your patient or the person that you're responding to have anxiety on top of whatever ailment they're having. Okay, and so when you respond to an emergency, you want to always make sure, number one, your safety first. And so what that means is if you are going to risk your safety, then you're not any good to the person that you're helping. So you want to make sure that before you respond, that the scene is safe and that you have everything that you need to help that person. And you want to call 911 right away. So when we're responding to emergencies, and I'm going along with your slide, your PowerPoint for first aid, so you should have this, and I would encourage you to um, follow along with me. So the first steps is to be alert in the emergency. So you're going to listen for screams, broken glass, screeching tires. In the case of a suicide attempt, empty medicine bottles. All of those things you want to make sure that you are aware of when you respond to an emergency. The next thing you want to do once you determine an emergency exists, you want to check the scene again. And then if the scene is safe, then you can proceed. You want to always try as well to get the person's permission before responding. And so if there is a child present, you want to make sure that you reach out to their parents and ask to get their permission, okay? Also, you want to make sure that on the scene that you're not providing any quote unquote diagnosis. You just getting your information to help the patient. If the person does refuse, however, do not proceed. But you can call 911 and then get someone to document that this person refused. You always want to prioritize care, so you want to deal with life-threatening emergencies first. And then make sure you have someone that's available to jot down information. So the name of the person. Also, you want to have them jot down what happened and last vital signs if you can get that. You want to make sure that you avoid unnecessary movement of the victim. What that means is you only move the victim if they are in immediate danger. So some things, immediate danger would be in the way of oncoming traffic, immersed in snow, immersed in gasoline, all of those type of things. You want to make sure that you're removing the victim. And then also according to Good Samaritan law. Now, the Good Samaritan law will cover you if you provide emergency help that can save someone's life under two conditions. Number one, that you acted in good faith. And number two, you only provide the care that you are qualified to do. What that means is if you are a nurse, it is outside of our scope to, for example, put a trach or put a trach in someone or doing things like that or suturing a finger, things like that. You don't want to do those type of things. You want to make sure that you only provide the care that will stabilize the person and that you are qualified to do so. So let's talk about some specific types of emergencies with respect to wounds or fractures or cuts. So the first type of wounds that we can provide emergency care for is either open or closed wound. Okay, so open wound presents an obvious um, effect, which is infection. So you want to look for, make sure any extra drainage. You're going to look for warmth and induration, all signs of infection. Closed wounds, however, we can't really see on the outside what's going on, but we need to look at things such as blood pressure. So if the person is internally bleeding, you're going to see some signs such as low blood pressure, increased pulse, maybe bruising around the skin, things like that. So those are open and closed injuries. Abrasions are really just primarily scrapes to the skin. Bleeding is limited, and then what we need to do for that is maybe just clean the area up and prevent pathogens from getting in there and cover the area. Incisions with things such as knives, razor blades, what have you. You want to make sure, number one, after we clean that up, number two, tetanus shot. You want to assess when the last tetanus shot was and have that information available too when they get to the hospital. A laceration includes just excessive tearing or jagged edges or deep wounds that can easily become infected. They are at risk for heavier bleeding, and you want to make sure that you're applying pressure to the area to control that bleeding. Really important, though, I always say, make sure that you're safe first. So if you don't have gloves, I wouldn't suggest applying pressure with your hands, but you might want to use maybe some padded blankets, or maybe they have a shirt that you can ball up and you can protect your hands. So again, safety always first for yourself, and so you don't want to come in contact with bloody fluids as well if you don't have gloves. But just as a rule of thumb, nursing students maybe should always carry a first aid kit in their trunk, and also some gloves as well. But if you don't have those, don't use your bare hands. The other concern that we have is maybe separation of a body part from the body. In this instance, maybe a toe or a finger. You want to make sure that you preserve that body part, because when they get to the hospital, the surgeon may want to reattach that. And so the way we preserve that part is you do not place the body part in direct contact with ice because of tissue necrosis. So that may cause tissue death. What we can do is wrap it up maybe in a moist towel, put it in like some warm or room temperature water with sterile water in a plastic bag. But do not put the body part in direct contact with ice. Then we just want to talk about the differences between arterial blood and venous blood. Arterial blood is that blood that is bright red, or it might be just pouring out from a person. That type of bleeding, the person is at risk for severe drop in blood pressure, also heart increase in heart rate. And so you want to make sure that you're applying pressure there. You also want to make sure that, again, that pressure that you apply, if you put a pressure dressing on there, that is not too tight where it cuts off the circulation. Venous blood is a little bit darker, and so you can, again, apply pressure there. But because it's slower, we got a little bit of more time. I kind of talked already about the signs and symptoms of infection, so the next slide goes into that, so I'll pretty much skip that. But internal bleeding, again, we did talk about vital sign changes, but also you might see cold, clammy skin, and also restlessness if a person is losing blood in closed wounds. This next slide I want to talk about is called shock, okay? And so whenever there is a potential for loss in blood, the person is at risk for shock. There are 3 different types of shock that I want to talk about. It's also located in your book. If you're using the Med-Surg book, which I hope you are, starts on page, in your book, 1044, and it goes to 1046. I apologize, 1042 to 1046. And so there's 3 types of shock. You have, the first one is hypovolemic shock. Hypovolemic shock essentially is a decrease in fluid volume. And so the goal in treatment is to replace that volume through either blood products and also IV fluids. With hypovolemic shock, also you're going to see a decrease in blood pressure and also an elevation in the heart rate, also along with the other signs and symptoms of shock. The next type of shock I want to talk about is cardiogenic shock. Cardiogenic shock is actually where the cardiovascular system is losing volume or also function, and we want to restore that function. And so in order to do that, we're going to give what's called vasopressins in order to restore the cardio function. And then we have anaphylactic shock, which is caused by allergens. Anaphylactic shocks usually is because of maybe a bee sting, maybe it's something the person ate. A couple of things you want to do with anaphylactic shock. Number 1, you want to remove the person from the allergen. Also, you want to make sure if they have an EpiPen that we give that to them right away, and also get them help to the hospital immediately. Sometimes anaphylactic shocks also can be caused by insect stings. And so if you have a stinger that you can see on the outside of the skin, you want to probably just remove that with a tweezer. Regardless of what type of shock we're talking about, there are some symptoms that are common to all 3. Number 1, it would be pale skin or cyanotic skin, diaphoresis. Of course, I've said pulse, which is rapid and weak, low blood pressures, restlessness of the victim, anxiousness, and also some complaints of being thirsty, complaints of nausea and vomiting, and blurred vision as shock progresses. So for shock, regardless of what kind it is, you want to, number 1, eliminate the cause. So if it's because of hypovolemia, you want to store blood volume. If it's because of myocardial infarction or heart problems, you want to give those medications such as vasopressors to restore cardiac function. If it's because of anaphylactic, you want to remove the cause. You want to improve circulation to the brain. You want to provide oxygen, maintain body temperature as well, and then position the patient depending on the injuries as well. Next topic we're going to talk about is poisoning. And so, rule of thumb with poisoning. With poisoning, you want to make sure that immediately the person calls the poison control center. You want to make sure, if they're not available, you want to get them to call emergency medical response, which is 911. You want to make sure that whatever substance was injected or was ingested, that you want to make sure that we keep a copy of that and give that to the poison center or to the hospital that's treating the person. At the hospital, they may induce vomiting. I would not suggest this at home just because of the risk of choking. A couple of cases where you don't want to induce vomiting is where if the person has ingested a substance that may have erosion or acid, because it may cause burning of the esophageal tract. All right. Carbon monoxide poisoning. Carbon monoxide poison is actually an odorless or colorless gas. And sometimes, recently it happens, or not recently, most likely it happens because a person has maybe an old furnace. And so it may create toxins in the area. Individuals may not even know that they're at risk for this. And so if we're responding to an emergency where there's carbon monoxide poisoning in the home, if you're a responder, remember what I said. You want to make sure that you check the scene first. If you have people that are passed out in there, you make sure you hold your breath and get them out as quickly as you can. If you can provide CPR, do that. You don't want to do rescue breaths without anything on your mouth, of course. So if you don't have a face mask, you might have to just do chest compressions as well. And again, you want to call 911 right away. Skin that has come in contact with chemicals or poison, you want to make sure that you're washing that area with warm soap and water. And you can apply hydrocortisone cream or some type of anti-itch cream for that area. Or you may be able to use mixed baking soda with water and put that on there, but you still want to obtain medical help because you don't want them to go into what we call an anaphylactic reaction if they are allergic to it. For insects or snake bites or stings, if possible, you want to hold the area below the level of the heart. You want to also make sure that you watch for allergy response and monitor for shock, of course. And again, remove the stinger if it is on top of the skin or if you can see it with your eye. Burns. With burns, we want to classify burns as either first degree, second degree, or third degree. Researchers said that we can also classify them as either partial thickness or non-partial thickness wounds. I think that's what your book refers to them as. Superficial burns only affect the top layer of the skin, which is the epidermis. It heals really quickly, usually doesn't cause any scarring. The skin may be red and it may swell as a protective measure of the body. You want to make sure that those areas, again, you don't want to put any oil on top of that. You want to let that just heal by natural intention. Second degree burns are a little bit more serious, and they involve the epidermis and the dermis. And so with second degree burns, as they heal, a blister may form. These are very painful, and you want to encourage the person not to pop those blisters because of infection risk. And so with these, you want to leave them open if the skin is closed. Don't put any oil on them. Don't put any grease on them. And no regular gauze as well. Third degree burns are a little bit more extensive and usually are caused by maybe house fires or large flames. And so with this type of burn, there is a risk for electrolyte imbalance. Also, the patient's nutrition stores may be affected, and the patient is at risk for demise very quickly. And so these people may be admitted to a burn center with the goals of treatment of pain management, restoration of nutrition, and also prevention of dehydration. And so, and also prevention of electrolyte imbalances. So with that, they'll probably have to do some skin grafting as well. Rule of nines may be important here as well, knowing how to calculate how much of the body is burned. Treatment for burns, you want to make sure that we remove the source of heat, cool the affected area, and then relieve the pain and observe and treat for shock. Is right. And remember, with shock, you want to make sure that you're restoring fluid volume as well. And then some more directives for burn. You want to make sure, again, that you do not break those blisters open. Remain calm and reassure the victim as well. Again, no cotton, no grease, and no oils or powders. For bone and joint injuries, you want to be sure, number one, that we get this person an x-ray, okay? And so the couple bones or breaks that we may have are simple and closed, or open and closed, I'm sorry. With open, again, the risk is infection. With closed, it does not break the skin, but we need to be careful about some underlying things that we can't see under there, all right? Fractures. You want to make sure that if the person has pain, tenderness, and limited mobility, that we are splinting that fracture or casting it. If it's of an arm, you might want to have a sling for that as well, immobilization things. Dislocation of the joint. With dislocation of the joint, this is where the end of the bone moves out of the body compartment, usually because of tearing of the ligament. So signs and symptoms include deformity, also limited range of motion as well. And so with these, you want to actually immobilize the joint. I did talk about with one of my lecture class, my son who had a dislocated shoulder. And so one of the things that they required him to do was rehab of that shoulder. So maybe some rehab exercises. You got to be really diligent about doing those, or else if you have surgery, it's not really effective because you're not following the directives of the doctor. I'm sure everyone has had a sprain, maybe to an ankle. And so for that, you really want to make sure that you're resting the joint and then using what we call the RICE acronym. And so that is rest, ice, compress, and elevation. All right. So that's rest, ice, compress, and elevate the area. Symptoms are similar to fracture with the exception of the bone is not broken. Okay. Strain comes from overstretching the muscles. Signs and symptoms include pain, swelling, and bruising. And then also treatment is directed at resting the area and maybe putting some heat on that as well. These next couple of topics I'm going to talk about, we've had all during our semester together. And so for this, I want you to just concentrate on rescue efforts in teaching for victims. First one we're going to talk about is heart attack. And so it's also called a coronary thrombosis or coronary occlusion. So what happens is there's a blood clot that forms in the heart and the blood supply to the heart is blocked. So if the heart stopped beating, of course, we have to provide CPR. With heart attack, the patient may or the victim may complain of referred pain to either the jaw, arms, or neck. And so because these pains are what we call vague, they may miss that. And so time is of the essence with a person with a heart attack. We're going to get oxygen to that heart muscle. If they have nitroglycerin at home, we could tell them to take that, but they still need to call 911 if those chest pains have not subsided. Also, we're going to look at cyanosis. The victim may be weak and what's called apprehensive, so they might also be short of breath as well. Stroke. So individuals who may have or think they may have suffered a stroke in the home environment, you want to make sure also that they get to the ER right away because time is of the essence. And so with stroke, we need to educate individuals that we need to differentiate this from TIA in that those symptoms, they resolve without any deficits. But with a true stroke, there is a clot that has landed in the brain, and some signs and symptoms will be numbness, paralysis, unequal pupil size, mental confusion, slurred speech. And so with these individuals, we need to get them to the ER right away so that they can get a CAT scan to see if they are eligible for what we call TPA. TPA is given as soon as possible, probably within the first 3 hours, to prevent a stroke or to stop that clot, to bust up that clot. If someone has what we call a fainting episode, one of the things we want to do is we want to make sure that we change their position. So what a fainting episode is a temporary reduction of blood supply to the brain. The victim does regain consciousness after being in the supine position. So what we can do, a couple of things is Trendelenburg position, where we elevate the feet and the head is back, or you can have the victim put their head between their legs in order to get get oxygen to the brain. If the victim loses consciousness, however, we want to make sure that we maintain a patent airway. So that would be priority. Convulsions or epilepsy. So during seizure activity, it happens when there is an infarct again in the brain. It's several different types, but we won't go into that. With this seizure, you want to make sure that you're teaching individuals at home to be aware of seizure precautions, particularly if they have epilepsy. So one of the things you want to make sure is that they are not driving, because if they have a seizure while they're driving, they won't be able to, even if someone's in the car, they won't be able to help them. So they shouldn't be driving. Also, they should take showers instead of baths for fear of drowning. You want to make sure that they don't put anything in the mouth and don't restrain the person. In the home environment, you want to make sure that they have pre-seizure precautions. So maybe the bed is low, mats at the side of the bed. There may be suction available in the home, maybe not. That's just up depending on if the individual has that. There are some medications that we give as needed with seizures or epilepsy, and they are called usually lorazepam and diazepam. We usually give those, or emergency response usually gives those if the person is seizing in hopes to bring them out of that. But again, diazepam and Ativan are not used as like daily seizure medications. They're used only in emergency. Diabetic coma. And so diabetic coma can happen a couple of ways if the blood sugar gets too high or too low. In the case where it's too high, it's a result of the person having too much of those foods that they're not supposed to eat, or they haven't taken their insulin. Signs of a diabetic coma or impending coma: confusion, weakness, dizziness, nausea, vomiting, deep rapid respirations if we're talking about diabetic ketoacidosis. The victim will lose consciousness if not treated. So we got to get this person to the hospital right away. Insulin shock usually happens because the person is taking too much insulin. So they will notice a drop in blood sugar. And so if the person is still conscious, you want to make sure that we give them orange juice or candy. If the victim loses consciousness or are confused, you do not want to put anything in the mouth. Stress that. You want to make sure, again, this person, if they have glycagon in the home, which is actually just glucose, you want to give that to them to bring up the sugar if they are unconscious. Until medical help arrives, we want to make sure that we cover the person with a blanket, avoid giving them anything to eat. This is for overall emergencies. If emergency help won't arrive for more than an hour and dehydration is evident and they are alert, you want to make sure that you give them something to drink. Okay? Just as a rule of thumb, individuals who are unconscious can still hear what's going on, so you need to be cautious about what you're saying and also cautious about making diagnoses or statements at the scene. So that is the first aid lecture. There are a couple of more in this unit, which I will do. I'm going to do them as separate videos so that this video is not so long and doesn't have a long time to upload. So I'll see you at the next topic, which is emergency and trauma and domestic violence. Bye-bye.